I'm Tim Rawson. I'm a senior clinical lecturer at Imperial College London, United Kingdom, and my research interest is in clinical decision support systems and approaches to optimise antimicrobial prescribing. Clinical decision support systems, or CDSS, are essentially electronic tools that help healthcare professionals or patients make decisions about their healthcare. They tend to be integrated into electronic health record systems or delivered in individualised fashions via mobile devices. In this discussion, I'm going to focus on clinical decision support systems for optimising antimicrobial prescribing. Clinical decision support systems have been demonstrated to improve the appropriateness of antimicrobial prescribing and reduce overall antimicrobial consumption in secondary healthcare settings. Additionally, they can improve the financial situation of hospitals by saving money on antimicrobial prescribing. There is limited but emerging data to also suggest that the application of clinical decision support systems can help improve direct patient outcomes, such as length of stay. However, there's a lack of data to support direct patient outcomes like mortality at present. In terms of CDSS, we've spoken about some of the advantages, and in general, clinical decision support tools tend to be well received by end users, and people report positive feedback about using them. However, there are also challenges with these type of system. So first and foremost, the implementation can be challenging. Often clinical decision support systems may not be well integrated within other electronic health record tools which we will use in hospitals. Secondly, the effectiveness of the clinical decision support system can sometimes wane over time. So that means we see failures or reductions in the amount of appropriate antimicrobial prescribing using the guideline over time, or lack of user engagement with it. When we explore why that is, often we find out that these tools are quite narrow in their focus, and so often they don't account for those inter-individual variations which we see in practice, meaning that people often struggle to use the guidelines provided within them to make an appropriate decision. Looking forwards into the future, there is a huge opportunity for us to utilise data that is being generated through electronic health record systems and laboratory information management systems to enhance the way that we use clinical decision support systems. First and foremost, the opportunity to apply artificial intelligence to be able to much better understand complex data and present it in a way that's interpretable and usable by clinicians, but also to make predictions about the future, to be more precise in looking at the patient from an individual perspective rather than taking a population level approach to this. In order to realise the full potential of clinical decision support systems using artificial intelligence, as well as designing clinical trials that will provide adequate outcome measures of these interventions, we can also begin to embed clinical decision support within electronic health record systems that capture clinical trials information. The benefit of this is we can then use randomised data to begin to train and improve the models which we develop and incorporate back into the system. One of the other benefits of clinical decision support tools and many of the developments that are occurring within this field is that we don't just need to focus on antibiotic prescribing, it provides us the opportunity to provide decision support across the entire decision-making pathway. When we are managing infections, we go all the way from the syndromic diagnosis of the patient all the way through to prescribing antibiotics and stopping antimicrobial therapy. Clinical decision support tools provide us with the opportunity to bridge the gaps between syndromic diagnosis and obtaining diagnostic information to help us make decisions. So for example, it allows us to think about providing early empiric therapy which covers the patient's infection and could also help us guide appropriate microbiological investigations to ensure that we optimise the diagnosis of the patient as early as possible. Looking forwards, clinical decision support systems are evolving rapidly, and to support this, we need to ensure that we have good clinicians using them. To successfully achieve this, it's going to involve engagement in design to ensure that tools are acceptable to the users that are going to interpret them, and making sure that education is provided to help understand the underlying technology which is driving the decision support mechanisms being presented to the individual. The key messages are that clinical decision support systems can provide significant added value to antimicrobial stewardship programs and hospital economics. They can allow us to move towards delivering more individualised care for our patients, and as data linkage and availability becomes much more available, we're going to be able to be much more precise in the way that we recommend and enact antimicrobial prescribing decisions, as well as diagnostic decision support.